Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we've been discussing a medication known as Armodafinil. Its brand name is Nuvigil. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. And quickly, if at any time during this video you find the information to be valuable, please consider leaving a like on the video as it would really help me out with the YouTube algorithm. So first off, what will we cover in this presentation? We're going to start by talking about how armodafinil works. We'll discuss indications or reasons we would prescribe this medication to a patient, then contraindications or reasons we would not be able to prescribe armodafinil, followed by examples of dosing, and then stick around to the end where we'll talk about side effects with percentages. So how does armodafinil work? Well, we do know that armodafinil is an alpha-1 adrenoreceptor agonist. However, the exact mechanism of action that promotes wakefulness is not completely understood. So now what about indications or reasons we would prescribe this medication? So we see it often used in narcolepsy as well as obstructive sleep apnea. We see this medication prescribed in shift work sleep disorder, and it can also be used for this off-label indication in the depressed phase of bipolar disorder. Now for contraindications or reasons we would not be able to prescribe armodafinil, the only one here would be if the patient had a hypersensitivity or allergy to modafinil, armodafinil, or any other component of the formulation. Now for examples of dosing, so in narcolepsy we may see 150 to 250 milligrams orally as a single dose taken in the morning. During use in shift work disorder, we may see 150 milligrams orally daily about 1 hour before the start of the work shift. And then for the off-label indication of bipolar disorder, we may see 150 milligrams orally once daily. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using armodafinil, so I'll go over some of those here now. Dizziness may happen 3 to 8% of the time, while 14 to 28% may experience a headache. 1 to 4% of patients may experience a rash, and diarrhea comes in between 3 and 5%. Nausea may happen 6 to 14% of the time, and xerostomia or dry mouth may happen in 2 to 7% of patients. Insomnia may happen 4 to 6% of the time, and anxiety may happen 4% of the time. Now, some more rare but serious side effects would be suicidal thoughts or depression, as well as anaphylaxis. That's all we're going to talk about today with armodafinil or Nuvigil. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information to be valuable and you'd like to help grow this channel, remember that you can like the video or subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.